In today's video, we're going to be talking about the true possible side effects of having a Botox or a Dysport injection. On social media and YouTube and even TV, again, the word botched is becoming so popular, and we usually see the horrible outcomes. The purpose of this video is really to inform our clients and teach them about the true possible side effects, especially when the procedures are done correctly. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and for the last 25 years I've been building my business here at External Affairs Medical Spas. Our specialty is aesthetic treatments as well as regenerative medicine, and our goal is to bring you all the latest information on these topics. Please like and subscribe and share our videos, and be sure to put comments down below if you have questions about any procedures. So prior to having your injection today, Carrie, we're actually going to review your consent form for the Dysport, which is what you're using today. So you are aware that we're going to use a small amount of a purified botulinum toxin. Today we're using Dysport instead of Botox. We're going to be injecting that into certain muscles, which will cause a weakness to that muscle, so you won't be able to contract it, all right? It'll take anywhere from 2 to 3 days. Typically Dysport kicks in a little bit quicker, but up to about a week. Typically lasts around the 4-month mark, but there are certain areas that might not last as long, and I'll kind of go through that with you as well. So we're going to talk about risks and complications. So I like to explain to clients that there's certain areas if we over inject. So for example, the forehead, if we put too much up here, we're going to relax all those lines, but we're actually going to make this feel too stiff and possibly drop the brow down. So I'm going to do a very conservative approach, just so that you still have that ability to pull up. So I mean, if sometimes we'll hear about patients having this really heavy brow, if they've gone somewhere and they've had too much put up there, that's kind of considered like a brow ptosis or a brow drop. On the consent form, you're going to see about an eyelid ptosis, which there's a muscle that runs around in through here, and if a tiny bit of the medication got into that muscle, it could actually make this heavy. It is extremely rare, all right? Probably about 1 in 1,000 cases. Typically, sometimes we'll actually see like a pre-existing ptosis. So we know that those patients might be, more prone to that. But it is a risk, Sometimes patients, if it's the first time, you can feel like a tiny bit of a headache for a couple of days. Sometimes when we're weakening one muscle group, we'll get resistance in another. Dysport is known to have less of a complication with that, so hopefully that will be fine. Probably more common is bruising. I'm going to be using little tiny needles around here, and if I nick a little vein, it can cause a little pinpoint bruise. But you can certainly cover that up with makeup. Alrighty. And of course, we're going to take pictures. Alrighty. Any questions?
No.
Great. So I just want to review with Carrie basically the longevity. We did use Dysport today, but it's similar longevity if we were using Botox. So I want to talk about, first of all, the most popular area, which is between the brows here. What happens in time for patients that are getting regular treatment, say every 4 months, their habit starts to change here. So frowning is a bad habit, right? So while the drug is working and you can't make that frown face, this muscle will actually start to get a little bit weaker. And in time, even when the drug wears off, you're just not going to do it as much. So we usually say about the 4-month mark, but in time that might spread to 5 months or 6 months. And sometimes we'll actually start to decrease the dosage here because it's getting better and better and better. Now, the frontalis area up here, when it wears off, I mean, first of all, we don't use a lot there. I could put more to make it last longer, but I would rather allow you to have that movement, because raising your eyebrows up is a great expression. It's I'm happy or I'm surprised. So we want you to retain that ability. So typically I'll tell patients that up here it is going to wear off faster, maybe around the 2-month mark, but you can always pop into the clinic and just touch that area up in between treatments, because usually this will last you longer. All right. Now, crow's feet, usually around the 3 or 4 month mark as well. And again, as soon as the drug starts to wear off, when you smile, your cheek is pushing up and kind of making those little lines as well. So typically around the 3 or 4 month mark. Okay. Same with the bunny lines. Now the upper lip is another area where we underdose. We really just put a tiny little bit because you need to use your mouth.
Yes.
So because I only put 4 units there, if you love that treatment, you can always come back about every 2 months. You know, 4 units would be around $40, and you know, you can get that little cute little pout again. Alrighty, great. So when we're talking about side effects, I thought that it would be good if we sort of break it up into what's more common side effects and kind of make our way down to what's less common. So when it comes to any injections done, you know, especially with Botox or Dysport, first of all, we're using very tiny needles. They're actually little insulin syringes. So the little pokes are extremely small, but there is a risk that that needle nicks a little blood vessel, and sometimes that can cause a little bruise. So you do want to make sure that you're planning ahead of time, that you don't have any super important events, just in case you did have a little bit of bruising or swelling from an injection. And we're just going to show you a clip of how many blood vessels are in the face. We kind of get a kick out of it as injectors when people say, oh, please don't bruise me. But really, if you're to look at how many blood vessels are in the face, it looks like a road map. So we certainly do our best, but my little expression is plan on having a bruise, and then if you don't, it's a great day. Second thing I want to talk about is something that we're seeing in the industry, and that is more about sort of overdosing, you know, or injecting too much Botox or Dysport in certain areas. In particular, the forehead. You know, we're seeing a lot of patients coming in from other clinics, and they've just had way too much put into the forehead, and you know, they have no movement and they have no lines, but they also can't lift their eyebrows up. So I am going to kind of put out a buyer beware. Make sure that you're being underdosed in that area, and if you want more, you can always add a little bit more in time, but you really want to retain the ability to lift those eyebrows up and down. When that happens, it's actually referred to as a brow ptosis or a brow drop. You know, unfortunately, when it happens, it's really just time that makes it reverse. But just be careful, just don't get too much put in that area. Start with a low amount and then gradually move up. The last thing that I want to address about, you know, complications or side effects, which is extremely rare, it's called an eyelid ptosis. It's when there's a little bit of the drug, whether it's Botox or Dysport, actually gets into a certain part around the eye, and it actually drops the lid down. Usually the incidence is about 2 in 1,000 patients. I've been injecting for almost 20 years, and I've seen it twice in that time frame. It is a possible risk, but just know it's super rare. It's really important that our patients understand that you know, Botox, Dysport, Xeomin, they are medications and they need to be treated as such. You know, in our clinic, we take that very seriously when we're doing our consultation. You know, our physicians going through the medical profile, making sure that patients are good candidates. We also want to make sure that they really read the consent form very thoroughly and have the opportunity to ask questions. You know, that's very important. It's a patient right. After your procedure, you want to make sure that you follow the home care instructions, which includes to stay upright for 3 to 4 hours. It takes a few hours for the drug to bind to the receptor sites in the muscle, so it's important that you're staying upright and you're not manipulating the area for that time frame, just to allow the drug to take hold. That will help reduce, you know, the incidence of any of these more uncommon side effects. So don't go for yoga, don't go for massage, don't lay down and have a nap, just stay upright. That's super important. You can also apply ice, a little bit of pressure if there is any bruising or swelling. If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.